can't believe we're holding on to what we've already given up. It's like we're pacing around the obvious. Separate lives, different stories, 2 out of 4 of us are all fed up. Well, you and I play with fire, but don't say nothing, or we'll both busted. We'll get what's coming after you.
So this is a PowerPoint presentation on how to stock a med bag um, in a more self-sufficient or holistic approach to it. We start with what kind of aid you're going to be giving and how to treat these things. There we go. To then how to do it holistically and how to make your own. This is a PowerPoint presentation. I'm trying to turn into a video, so some of the slides are a little bit off for timing. For that, I'm sorry. We're going to do the best we can to sort through it and, take notes if you need to. So these are the things that you're going to need to understand and be able to treat. They're the things you are most likely to come in contact with that you would need some form of aid training to handle or supplies. So first is understanding the basics of aid. You need to understand virology and microbiology and what works with them and what doesn't. You need to understand airway breathing and circulation. You need to understand what shock is, and you need to understand various trauma injuries and how to treat them. And we're going to discuss all of that here. I know it's only a 30-minute PowerPoint, but we're going to get a good basic covering of everything. And you can always feel free to comment and ask me questions. So some of the first stuff that you need to deal with is sprains. Those are pretty obvious. If you see the image here, the bruising that is below the ankle, even though that's a sprained ankle, is kind of a giveaway. Blood tends to settle low. So if it's something in your leg, it's common for the bruising to actually show under the injury. Understand that most natural remedies work better in conjunction with other natural remedies. So you're going to want to mix your tinctures of ginger, turmeric, cardamom, etc., etc., etc. You don't have to have all of them. 2 or 3 will do. I would keep them separately and mix them as needed because a lot of them are for different works for different things. And so you're going to want to be able to mix them for other things too. Second trauma injury is breaks. I think this says most everything you need to know, except you would add comfrey and calcium. Calcium is important when somebody's healing a break. You can make calcium yourself with clean dehydrated eggshells, grinding them into a powder. You can put them in your own gel caps, or you can mix them in applesauce or pudding. It's still totally edible. When I say maintaining as much mobility as possible, bodies in motion heal faster. So though you want to immobilize the one joint, you want the rest of the body to be able to move. Trauma 3 is handling pain control. There are modern painkillers, Tylenol, Motrin, Aleve. Poppy seed sap, it says in the how to make handout. I'll post the handout at the end of the PowerPoint. Wild lettuce tincture, white willow bark or birch tinctures is the same thing as aspirin. Hemp products or CBD type products or that weed which shall be unnamed because it's still illegal in this state. Also understand treating inflammation with ice is important. If you can ice it, please do. Shock is an important thing to understand. Shock has its own slide, so we'll talk about that in a minute. Bleeding. You need to understand the difference between a major bleed and a minor bleed. In other words, if it's arterial or not, which means if it's spurting or shows a pulse point. That's important because then you're going to need to apply pressure to it probably for more than 30 minutes. And this means applying a pressure bandage. A pressure bandage, you put the bandage on top of the wound and then you tie a great big knot in a piece of fabric and set that on top of the wound, on top of the bandage. And then you tie that down with an ace wrap or another piece of fabric so that it applies pressure to the injury. And that way you're not left sitting there holding onto it the whole time. Understanding a sucking chest wound, that's specific to punctures or gunshots. And that's when a person can't get enough air in their body because they're sucking air through a hole in their chest. And you need to cover that with a piece of plastic. Shock. The definition is an acute medical condition associated with a fall in blood pressure caused by all sorts of things. The first thing you want to do is get the patient laying down, get their feet elevated above their heart. You want to focus their attention. If you focus their attention on anything other than what's going on, it's amazing the power of the mind to help pull them out of shock. Have them do 5-count breathing. That'll help focus them. And if you have it available to you, IV fluids. IV fluids help a lot, especially in a drop in blood pressure situation. The ABCs of airway breathing and circulation. Understand the airway, to unblock an airway, how to use a Heimlich. Airway support if swollen shut is getting a tube in there so that air can get into the lungs still. Get your CPR training. It's free, or very minimal cost. Most fire stations and Red Cross centers offer it. And it's well worth it. Breathing is the regular rise and fall of the chest. Everybody knows that. Normal respirations in an adult are 12 to 20 breaths per minute. Wheezing is when you hear or when you're listening to someone's lungs through a stethoscope. That means there's inflammation in the lungs. You'll hear that a lot with asthmatics or with somebody who's had their lungs irritated for something. If you hear crackling, a noise kind of like that, if you hear crackling in the lungs, that means they have pneumonia and that needs to be treated differently and with vigor. Pneumonia kills. Circulation, we talk about your normal heart rates in an adult, tachycardia or fast heart rate. A vasovagal reset is important. A vasovagal reset, you have the person hold their nose and blow, and while at the same time bearing down as hard as they can, as if you're trying to poop a football or give birth. And you bear down like that for 15 to 30 seconds as long as they can hold it, and then release it all at once and fast. That will reset the vagal nerve, which oftentimes will reset the heart rate. Bradycardia is low heart rate. It's how it's usually what usually causes it, how to treat it. Some microbiologicals. The first ones you're going to have to worry about are parasites, which are not always micro. You can see a lot of them with the bare eye. That's your worms, your roundworms, your tapeworms, heartworms, things like that. You can see them. Those can be treated naturally or with medicinals. You can't see the protozoa parasites like Giardia. A lot of times you can't even see them with a microscope. But if nothing else is working on your patient and your patient is showing all these signs of a worm infestation, treating them for worms isn't going to hurt them if they don't have worms. But it will help them if they do. And ectoparasites are your external parasites. fleas, ticks. Fungal infections. Candida thrives in warm and moist places. So the easiest way to keep it from happening is to prevent, right? Stay clean and dry. If you can't do that, apple cider vinegar half and half with water to clean the area and then pat dry, or soaking for 10 minutes and then patting dry, or oil of oregano or tea tree oil applied to the affected area. These things will all help fungal infections. Kinds of bacterial infection. So there is an internal and an external, right? You can have a bacterial infection, say in your lungs, bronchitis, or you can have a bacterial infection in a wound. So the different ways to treat this are pretty simple to understand. So there are other kinds of internal infections. Obviously, there's a UTI, white spots in the throat. Indicates usually bacterial infection. There's ear infections, which are bacterial infections. These are all other kinds of internal bacterial infections that you'll need to think about. If you don't have a doctor or antibiotics handy, then this is kind of the way to do that. Virology, what you need to understand about viruses is that antibiotics will not treat them. Antibiotics are looking for a completely different bug in your system. So it is pointless to take an antibiotic if what you have is a viral infection. You can boost immune support so that your body can deal with the virus itself. You do that with magnesium, zinc, vitamin C, or you can take antivirals, which is holy basil, sage, fennel, garlic, oregano. I suggest doing both at once. It should be mentioned there that all the poxes, chicken pox, monkey pox, they're all herpes virus. So when it says helps treat poxes, anything that's a herpes virus, shingles, those can all be treated better with certain herbs. These are things to actually stock in your med bag. Now, I assume that your med bag is going to be any place you are, but it's possible it'll be a power down situation. It's possible that you'll be in the car on the road and you don't have a place to plug things in there, or you can't get to the store, or the store's out of batteries because there was a run on them, like, oh my God, toilet paper during COVID. So these are the things that you're going to want in there to use. Um, and I suggest, with as many of them as possible, getting non-battery operated ones, like your thermometer. Uh, the gallon clean Ziploc freezer bags, that will, the 1 gallon clean Ziploc freezer bags, those will be the perfect type of plastic if you do need to cover a sucking chest wound, ever. And they're Ziploc bags, so they can hold any number of things in them, and they're very handy to have. So you should always have them in your med bag. Needles and tubing is specifically for if you're going to be doing IVs. This is relatively self-explanatory, except for I did want to mention a lot of people use tea tree oil. Tea tree oil is a wonderful thing, but tea tree oil comes from a different country, and if for some reason we're not getting things from another country, you're not going to be able to get more. So you need to know how to replace your tea tree oil, what to use instead of it. Oil of oregano is a good replacement, but you need to make sure you get the food safe kind so that it can actually go in your body and that it's not just an aromatherapy thing. So now once you're stocking your apothecary, right, for your viral treatments, you have these plants that work best towards viral treatments. I tried to stick with plants that grow local to us here, and that's East Tennessee. So, if you see something there you don't recognize, you can always look up on the internet what grows close to me that does this. And, it'll show. Same with the antibiotic treatments. There isn't a fast and hard cure for vomiting in the natural world. You don't get a this will make you stop puking. What you can get, however, is this will make you feel less nauseous, less like you need to throw up. So there's quite a few of that listed there. Um, Teas are usually the easiest way to get it in, unless we're talking about somebody who can't hold anything down, and then you're going to have to think about a suppository. How to make those is further on. Diarrhea, asthma, poison oak, ivy, and sumac. And these are some last ones for chronic conditions and allergic reactions. Stinging nettle is amazing for allergies and allergic reactions. In chronic conditions, what if you run out of blood pressure medication or blood sugar medication or cholesterol medication? Black seed oil will handle that for you. Now it tastes god awful, but if it's saving your life, handle the taste for 30 seconds a day. Prickly pear is interesting in that it balances blood sugar. If you have low blood sugar, it will bring it higher. If you have high blood sugar, it will bring it lower. So that's always a good thing to know and have on hand if you're stocking a medicinal garden. Suppositories, as gross as you think it is, if you have an unconscious person, a child, a person who's throwing up too much to hold medicine down, or if you're treating a woman's internal infection for bacteria or yeast, um, you need to know how to make a suppository for that. Future viral outbreaks. The last I heard, the WHO was talking about monkeypox and the CDC was talking about bird flu. How would you treat those? Well, with your antivirals, your respiratory support. Febrifuge means fever calming, rash calming, immune boosting. Right? All the things we've already talked about. Just you have it there ready. This particular picture of this particular tincture, under the last research I did, it was the most likely one to work towards a pox. So I just included the picture there so that you would know. Okay, in Tennessee, I just gave us 8 examples of weeds that grow in everyone's yard here and what they do. So purple dead nettle is the first, and there's a good picture of it. Masticated means chewed or bruised really good. You can bruise them by putting the leaves between your hands and crushing them back, rubbing your hands back and forth and crushing them. Or you can put them in a mortar and pestle and crush them up. Um, Either way, you want it crushed. You want the juice from the leaves oozing out as much as possible. Uh, Next, we have henbit. Henbit looks, because of the flowers, I think pretty similar to purple dead nettle, but the leaves are totally different. If you look back at the purple dead nettle leaves, those were kind of spade shaped, and these are roughly circles around the stem. And so there's your difference. Um, if you see these weeds in your yard, you can pick them. And if you don't have a dehydrator to dehydrate them in, you can hang them upside down until they dry naturally. And then, crumble them into a Ziploc bag or a mason jar, label them and set them aside. As long as you put them in a place that they don't get sunlight, because sunlight ruins the efficacy of most naturals, medicinals, foods, anything. Sunlight is destructive. So lyre-leaf sage also has similar flowers to henbit and purple dead nettle, uh, but does totally different things. This is all stuff like I got these pictures and the plants like walking around my backyard. I didn't even have to search broad. They're everywhere. Red clover, pretty much everybody has seen. Now, there is a clover that is super dark red, because if you'll notice, this one looks a little more pink or lavendery. The super dark red one is called crimson clover, and that's not the same thing. But red clover is really good for a lot of different medicinals. Um, Menopause, asthma, whooping cough, arthritis. Some people even use it as an antioxidant for cancer. Um, just about anybody can find, see, label that one, take it home. Philadelphia fleabane. The flowers are pink like this, or sometimes they're just white. I don't know if it actually works as a bane to gnats and fleas like the early American settlers used it as. I haven't tried that, but it has a neuroprotective effect. So that's really good for people with high cholesterol or Alzheimer's in the family. It's a diuretic and it's an expectorant. So it will make you pee and it will make you cough junk out of your lungs. You can drink it as a tea or take it as a tincture. If you allow the tea to cool, you can use it as an astringent on the skin and face. Broadleaf and narrowleaf plantain is another pretty common weed we all have in our yard. Um, Man, everybody here uses plantain for everything. So again, a masticated poultice. So you mash it up and put it on a wound, and it will reduce bleeding, and it will improve wound healing and reduces infection. But if you take it internally as a tincture or a tea, it also reduces inflammation and improves digestion and acts as an expectorant. So it's a pretty broad range plant to use. Mullein. This is mullein. Mullein has, if you can't tell from the picture, very fuzzy leaves. Feels like velvet. You can mash the leaves up and make a poultice out of it. It'll relieve the pain and inflammation of bursitis and arthritis. You can brew the leaves into a tea and let it cool to use as a disinfectant on an area, like if you're out of alcohol or iodine or hydrogen peroxide. You can roll it and smoke it, or burn it as an incense to soothe asthma or coughing and to speed recovery from respiratory infections. You can put it in a salve as an antiseptic or an antiviral. That stuff does everything. And the last one is ground ivy. This doesn't get much taller than 2 inches off the ground. Everybody's got it everywhere here. But again, works to treat respiratory ailments, coughs, colds, and bronchitis, aids in digestion, relieves symptoms of indigestion and gastrointestinal discomfort like bloating or diarrhea. So that's a pretty good one to collect and use. And if we ever finish with this slide, there we go. So get familiar with these weeds that grow, well, they grow all over here and most places in the country, to be honest, except maybe the desert. And if you don't want to grow your own herbs, or if you don't want to use the ones that are in the ground, look these up and know how to identify them. And you can use those to treat a myriad of disorders and diseases and infections and things. So get familiar with them. Buy them online if you have to. Make your tinctures. Tinctures last forever. So, have it available there so that if you need something to fall back on, you can. Or what if you just don't want to take modern medicine? I mean, some people are like that. This is just definitions of words that were used throughout the PowerPoint if you need to understand and go back. That's fine. It's there to help. I use tinctures more than teas because it's just easier to get a tincture down. You just put it under your tongue and let it sit there for 30 seconds and it will absorb right in. But a lot of people prefer teas. The life expectancy of your herbs dried is a lot less than with a tincture. So I tend to use tinctures because I know they'll still be there and still be good. Lastly, thank you to everybody for watching and listening. And please feel free to ask questions if you think you need to. And I will post the handout at the end of the PowerPoint here shortly. And we'll see what you think. Thanks for showing up. The handout that tells you how to make all of the things that we've talked about in here is immediately following the end of this slide. So don't disconnect yet if you want to get that.
I can't believe we're holding on to what we've already given up.
Screenshot here.